Hello friends, myself Dhanvin Shetty. Let's quickly discuss ventricles and CSF. Now CSF is what is CSF? CSF is an ultrafiltrate of blood produced from the choroid plexus lining the ventricles. Now initially CSF is produced in the amniotic fluid. Later on it is chiefly produced in the lateral ventricles, and some part of it is also produced in the third and the fourth ventricle. Few numericals you need to remember about the CSF. First one is the total volume of CSF, which is around 142 or 270 ml. On average you can keep it as 200 ml. Second point is the rate of CSF production, that is 0.2 to 0.7 ml per minute. That is the rate of CSF production, and the entire CSF volume is replaced 4 times per day. Entire CSF volume is replaced 4 times per day. So these are the three values you need to remember about CSF. Now how does the CSF CSF is a flow. CSF is produced in the lateral ventricles. Okay, it comes from third ventricle by passing through foramen of Monro, also called as interventricular foramen. From third to fourth ventricle it comes through a aqueduct of Sylvius. From the fourth ventricle it can get into the central spinal canal. Okay, but see, it can also get absorbed through these things, that is midline mesandy. There is one midline mesandy and two lateral lusca. From these things, okay, the CSF comes into the subarachnoid space and eventually gets absorbed through arachnoid villi into the superior sagittal sinus. Okay, remember CSF is produced by the choroid plexus and gets absorbed in the arachnoid villi. Okay, great. Next is the clinical importance of these ventricles. Now the main clinical importance is the pediatric conditions like hydrocephalus. Okay, it is the hydrocephalus. Now see, what is hydrocephalus? Hydrocephalus is nothing but enlargement of the ventricles. What are the causes of it? Now first important cause is how due to excess production. See, CSF is produced by the choroid plexus. So if there is any tumor of the choroid plexus, that is choroid plexus tumor, can itself produce a hydrocephalus. That is the first thing. Second thing is about communicating and non-communicating hydrocephalus. Look into this picture. If there is any obstruction within the ventricles, it is called as non-communicating hydrocephalus. If there is any obstruction outside the ventricular system, then it is called as communicating hydrocephalus. The cause for this non-communicating hydrocephalus is aqueductal stenosis. The cause for this communicating hydrocephalus is tubercular meningitis. Yes, the adhesions produced by the tubercular meningitis and also adhesions produced by the subarachnoid hemorrhage are the cause for the communicating hydrocephalus. So that was about communicating and non-communicating hydrocephalus. There's one more condition I already told you before, and that is ex vivo ventriculomegaly. In this also ventricles starts enlarging, but the reason for it is not the excess CSF. The reason here is due to atrophy of brain tissue. The brain tissue get atrophied and the ventricle starts enlarging. Now what are the causes for this brain tissue atrophy? I already told you, long-term disease, particularly Huntington disease, Alzheimer's disease, and sometimes even Pick's disease. These are the causes of ex vivo ventriculomegaly. There's one more interesting condition. It's called as NPH, that is normal pressure hydrocephalus. It is seen in elderly. It is idiopathic. Okay, it is called as normal pressure hydrocephalus because the pressure here rises periodically. Okay, the cause has been not known, but the theories has been proposed that it is due to disruption of the corona radiata. Okay, due to enlarging ventricles. Okay, the most important feature of this NPH is its clinical features, that is remembered by the mnemonic 3W. Okay, it is called as wet, wobbly, and wacky. Wet because it comes with the urinary incontinence, wobbly because there is ataxia, and wacky because there are cognitive dysfunctions.